Today I'm going to talk to you about coronavirus and why is it so dangerous and why we have to listen to what the public officials has to say. My name is Dr. Zeon, MD. You can find me on social media at OZeonMD. If you're on YouTube watching this, please subscribe. If you're on Facebook, please follow. Let's talk about coronavirus. Here are the topics. What is coronavirus? Why is it so dangerous? Global impact, frequent asked questions, and some safety tips. Number one, what is coronavirus? Well, coronavirus is a virus that affects the upper and the lower respiratory tract. Now, a virus is completely different from a bacteria, and they're treated completely different. If you've heard the term the flu, that also means influenza, which is a form of a virus, which, for the most part, due to vaccination and herd immunity, we are able to um, easily treat it, easily take care of it. Coronavirus, on the other hand, is something that we're panicking about because it has a very strong chance of mutating. It has the ability to go from different hosts, and right now, as it's affecting places like China, that's causing a lot of global panic and a lot of global impact, and we're going to talk about that. But the important thing you need to know is that this virus affects the upper and the lower respiratory tract. Number two, this is a misnomer because people say coronavirus. It's actually coronavirus disease 2019. When they say coronavirus disease, they mean that the person already has the disease. The name of the actual causative agent is called SARS-CoV. So SARS-CoV, as you can see, there's a 2. That means that there is a SARS-CoV-1. SARS stands for Severe Acute Respiratory Syndrome and basically explains exactly how the virus impact its host. It causes a very severe acute respiratory syndrome. There's a SARS-CoV-1, which basically means that we have encountered such a virus before in the past. How were we able to contain it in the past, and why is there such a global panic in part 2? Let's talk about that. Well, the CDC called this virus COVID-19. So coronavirus disease 19, the 19 stands for 2019. As I mentioned before, there's a SARS-CoV-1 and SARS-CoV-2. SARS-CoV-1 we have encountered before in the past, and I'm going to talk about that. SARS-CoV-2 is what we're currently working on. And the reason why there's 1 and 2 is because there has been a drastic mutation, almost a 18-year difference in terms of when we encounter CoV-1 and now that we've encountered CoV-2. So over time, the virus has been able to mutate, and now it's been able to penetrate the population much faster and much stronger. In 2002, that's when we encountered SARS-CoV-1, which basically led to a total infection rate of 8,000. In 2019, we encountered SARS-CoV-2. Now we have over 83,000 people infected. Based on our calculation, we're saying that this is probably about 100,000 people at this moment, just based on the projections and based on all the other cases that haven't been documented yet. So this is a big deal because a virus appeared once in 2002, and 18 years later it comes back much stronger, much harder to contain. The virus can affect multiple organ systems depending on the specific variant of it. However, 98% of the virus, the current CoV-2, affect the respiratory tract. In respiratory tract, people can lead to sneezing, runny nose, sore throat, dry cough, shortness of breath, and I should say death, because death has been proven that there's been a lot of cases of death. In terms of the systemic effect, it can cause fever and fatigue, but there are some subset of the disease that can affect other part of the body, like the intestines, it leads to diarrhea, the kidneys, and then the circulatory system. Here's a image of a mouse that showed that got infected by coronavirus, and the mouse was their lungs were dissected to see the progression of the virus. So if you go from A, all B, C, D, E, and F, you see that the progression of the virus impacting the lung parenchyma and causing severe problem, of course, severe respiratory problem. Once your lung is completely damaged to such a point that it cannot be replaced, then of course death is an ultimate end. Here's a um, electronic micrograph image of the coronavirus. As you can see, this is within the lung parenchyma. Those yellow dots are the coronavirus. If you look at them carefully, you can see that there's some spicules in those yellow dots, and that's to indicate that those are the spikes that they use to attach to their host so that they can insert their DNA. Here is a EM of the image, and you can see the image, the virus with the spikes attached to it. Here's a 3D rendering of the virus. Again, you can see the yellow parts are the spikes. You can see the red areas, and then you can see the pink in there. That's the RNA. That's the protein that gets. That's the RNA that gets inserted into the host. Here's an image from the CDC that shows the actual 3D rendering of the coronavirus, and basically that's those red areas are the spikes that gets to attach to their host to allow for the RNA to enter and lead to replication. When the coronavirus infects people, the most common symptoms has to do with runny nose, cough, sore throat, and high temperature. So watch out for people with high fever, or watch out for people who have had a higher or prolonged case of the flu. So they've had a symptoms like the flu, but it's been longer than usual. The flu or influenza, it's in most cases self-limiting, and but the most important part of the flu is that it's a preventable disease when you take your flu vaccine. These vials basically are how it looks like when the CDC is in a place where they're doing quarantine and they're testing people. So if you see these vials, or you see people carrying these vials, or people dressed in protective gear, you just got to try your best to protect yourself. How is it spread? So coronavirus is airborne in contact. That means people sneeze in the air, you can breathe it in. People can also sneeze on your hands, and you can touch your hands on your eyes or your mouth. Or they may sneeze on surfaces that you can touch and place in your eyes, and it can spread through those means. Is it dangerous? Yes. Coronavirus type 2 that we're talking about right now is very dangerous because there's 83,000 reported cases, and I'm going to show you in a few seconds that by the trajectory we are looking at close to 100,000 of case. And of that, we have about 2,800 uh, deaths thus far, and about 8,000 of these people, of the 82,000 that are affected, are actually in critical condition. So 2,817 total deaths so far. Part 2, what is coronavirus, and some of the history. So let's talk about the history of coronavirus. In 2002, the first case of coronavirus came from the Guangdong, China region, and this was called the SARS-CoV-1. SARS-CoV-1 was also, when it came in, people thought it was atypical pneumonia. So atypical pneumonia basically is when the person has a pneumonia that doesn't show that they have a bacteria pneumonia, shows that their X-ray is normal, and they have cough that doesn't have any production of sputum. So that's kind of atypical pneumonia, and in most cases, um, it's if it's viral etiology, most cases it's self-limiting. But during the time, they kind of ignored it, and it got bigger, and it starts to cause something called a global community impact, meaning that it starts to travel to places where people were coming from all parts of China to do trade, or go to a market, or go to buy goods. And before they knew it, it started to rapidly spread. And by July of 2003, it had a confirmed 1,000 infected people and 800 deaths. In 2002, of course, we were not as advanced as we are now because that was almost 18 years ago. And the mortality rate was pretty high because it mostly impacted people who were either elderly or had a much poorer immune system. So 2002 SARS-CoV-1 was much dangerous because the mortality rate is was really high. So you're looking at 50% of people who had it who were older died. So fast forward to 10 years later, there were smaller cases, smaller reported cases throughout. But 10 years later, there was a new mutation of coronavirus in Saudi Arabia. Saudi Arabia's coronavirus was a little bit different from SARS-CoV-1, and so the CDC and the World Health Organization actually termed this Middle East Respiratory Syndrome coronavirus, or MERS-CoV. Now, it's important to note here that there have been many variants of coronavirus: the human reservoir coronavirus, the MERS, the SARS, and so forth. So in Saudi Arabia in 2012, there were reported 124 cases and 52 deaths. But this one here has a very high mortality rate of 34.5%. Now, that's for the general population, not necessarily for people who were immunocompromised or people who were sick. Um, Places like Qatar, Tunisia, Saudi Arabia were the ones that had the virus. Now, the last bullet point here says that never went away. It's very important to remember that the 2012 virus actually led to a cascade of events that is basically one of the reasons why we have coronavirus today, and it's causing more problems. Then there were people traveling from Saudi Arabia that go to South Korea, Seoul, South Korea, to seek treatments. And it is said that the Middle East respiratory syncytial virus continued to travel from the Middle East to South Korea. And these families, basically, when they went to seek care, they inadvertently spread the disease. And in 2012, in Soho, it got worse, where 2,464 people got infected and 851 died. Actually, it pushed from 2012 all the way to 2015. That's when these confirmed death. And of course, it still had the same high mortality rate of 34.5%. Now, fast forward 2019. So this thing has not gone away. 2019, now we have Wuhan, China. This is where we saw SARS-CoV-2. Now, this is a mutated version of the first coronavirus we saw in 2002. And now this one here, it really impacted a very massive population. And this population will have a dominant global force and dominant international travels and trades. Basically made it easy for it to really spread fast and fast. Now, it's important to note that China does have a dominant global presence. So anything that really impacts the population in China will really tend to have a dominant global impact. And I'm going to show you which part of the globe and how it's actually impacting the globe. Now, because the population that it's impacted is pretty high, the death thus far is about 2,817, somewhere in the 2 to 3 to 5% range in terms of mortality. But some are making claims that is going as high as 8% now. So here's a recap of the different variants thus far, the important ones. 2002, 2003, we have the SARS-CoV-1 that impacted almost 800 people. 2012, we have the Middle Eastern coronavirus, which impacted over 400 people. But it continued to 2015 to 2018. And then 2019 and 20 is the one that we're talking about right now, which is the SARS-CoV-2. Global impact. So basically, if you look at this map here, you can see all the major red areas are where the coronavirus have had reported cases, both reported cases and death. You can see that in Africa, it's only in Egypt and Tunisia, but you can see Saudi Arabia, you can see Soho, you can see China, and you can see the United States, Canada, Brazil, and so forth. So this is a major global impact. If you look at this map from 2012, it tells you the total cases that are open currently, and these people are under treatment. About 43,000 are under treatment. 33,000 have been considered recovered from the disease, and then 2,744 people have considered dead from the disease, although now that number is much higher. So if you go to world's meters.info, you'll see that it's about 83,000 people who are affected, 2,817 are dead, and 3,355 and 50 are recovered. But if you go further, you see that of the active cases, you have 46,000 active cases. Now, the crucial part to pay attention to here is that the active cases, only 82% of the active cases are in mid condition, but 18% of that is in serious and critical condition. That's important because we're saying that the death is about 8%, and if you have 18% in serious and critical condition, and if they pass, that will increase our overall critical or death total to about 26%, which is pretty high considering the number of people who are already affected. Because 26% of 80 to 100,000 is 26,000 people. That's a big deal. If you look at the active cases, fortunately for us, it went high and peaked, and it seems to be dropping. But then the closed cases seems to be increasing. So that's a good sign for both the active and closed cases. If you continue, you look at both the linear here and the logarithmic graph of the total death, you see that there's a linear increase in terms of the logarithmic graph. There's a little bit of plateau there, but we still believe that it's still going to continue to increase until probably it hits close to the 10,000 case mark. The daily new cases on February 10th, there's a little bit of spike there, and then things kind of evening out. But starting the 22nd, there has been a massive increase in the daily cases of coronavirus. Yes, on the 26th, yesterday, there's been a major spike up. Almost 580 people were reported as having the virus. So as you can imagine, we believe that there's going to be a lot more cases being reported, and the numbers we're showing are going to be way astronomical. So these are the daily new cases. February 12th was the spike that I explained about. The total cases thus far, if you look at the linear graph, it still seems like it's going straight up. It's not really going down, but if you look at the logarithmic graph, it looks like it might be able to hit, over 100,000 plus before it plateaus. And this is what I was talking about. It looks like it's still going up slowly, but it still may be able to hit 100,000 plus. As you can see, that little dip here around February 12th, that's when that little dip, you see that little dip in the graph, it was going to plateau, but it went up a little bit, and that's how it's likely to go. Here are the countries that are currently affected, and there are different cases. China has 78,000 cases. South Korea, as we mentioned before, way back then, South Korea had encountered with this virus. They have 1,700 cases. Then you have Italy, you have other places, but the United States has 60 cases. Here's the world map showing, or not the entire world map, but like parts of it, yeah, showing where all the coronavirus is affected. You see the United States and Canada way on the far right there. But if you zoom in, you see China being a very dense place, is where there's more cases, 78,000 cases in China. If we look at some of the symptoms again, we say dry cough accounts for 98% of the symptoms. Fever accounts for 98% of the symptoms. Dry cough is there. Dyspnea, which is difficulty breathing, and then diarrhea and other cases. The characteristics of patients who have been infected with SARS-CoV-2, MERS-CoV, and SARS-CoV itself are here. If you look at the SARS-CoV on the far right, which is something that started in November of 2020, 2002 and basically peaked in July of 2003. The total case had up to about 744, close to 800. 2012 in Saudi Arabia, Jihad Saudi Arabia, they had almost 858 cases. Now in 2019, we say the case fatality is 2,708. Although, as I've mentioned, we've already surpassed that number. Why is this a global thing? Because the President of the United States is recognizing that this is a global thing and is recognizing that it starts to cause a major impact in the economy, especially considering how it's impacting the stock market. Yesterday, he appointed Mike Pence, Vice President, to be in charge of the coronavirus. Uh, but CNN has reported that the president is making less of a deal with coronavirus than he needs to because it's actually a much bigger deal than it is being represented by the White House. Of course, White House is going to take notice, and everybody else is going to take notice because panic about the virus itself, about China is one of the biggest manufacturer of goods and services for other global brands, the Apple and Microsoft and all these big brands. Well, the S&P 500 has been taking a hit 4.5% since this whole since December. But over the past, just over the past few days, Tuesday, Wednesday, and Thursday, they've taken a 4% dive. This is a big deal. If you look at S&P is 4.5%, Nasdaq is 4.6%, and Dow Jones is about 12.8%. So drop in value since the beginning of the year. So this is all big deal because they are telling us that the market is responding in a very, very big way. And of course, you're saying, why am I even going to worry about this stuff? Well, just imagine in 2008 when the market crashed and all these indexes were really low, you couldn't even get a mortgage. You couldn't even get a place to rent. So it's going to impact you because China, believe it or not, holds a lot of the world's goods and services that we mass produce to ship out. So a lot of companies are going to actually feel it massively because right now even the United States has banned any travel from China to and from China. So you got to be curious to know if they're also abandoning any kind of an import and export. Number four, let's talk about some questions and then we'll end this. What is coronavirus disease? Well, this is a viral illness, okay, which can cause an acute respiratory disease. And when they say acute and severe, that means it's going to come and hit you really hard. So this is a viral illness. So it's called coronavirus disease. It's dangerous because there's no cure and they don't even have any vaccines for it. As we said that the coronavirus 1 or SARS-CoV-1, basically starting from China, SARS-CoV-1 they really didn't maintain it or contain it. They just couldn't do much about it, but it kind of faded away over time. But now the second version of it is much stronger and is much deadlier. So that's why it's a very dangerous thing. And if you can see, the case fatality is about to hit 100,000 compared to 8,000 that it hit from 2002 to 2003. Can I take antibiotics for it? No. This is a bacteria. This is not a bacteria. It's a viral illness. Viral illness cannot be treated by antibiotics. A lot of people get pumped up on antibiotics when there's breakout about influenza or breakout about viruses. Viruses are not going to be impacted by any antibiotics medication. So please don't do that. How can I and my family be safe? Well, use what is called universal precaution. Use face mask, wear gloves, wash your hands, and so forth. Avoid crowded places. Pull your kids out of daycare where there's kids or are sick. Go and see a doctor if you have any symptoms. The World Health Organization said readiness is the key to detect combat spread of the new coronavirus. So the World Health Organization wants us to be ready because it's much easier for us to be ready and to combat the disease. Advice from the CDC and the World Health Organization that says you must wash your hands often, and make sure you wash your hands with soap. Cover your mouth if you're sneezing or coughing in public places, especially also if other people are sneezing and coughing and their mouth is not covered. You gotta be cautious. Wear a mask if possible. Don't touch your eyes or nose or mouth when you are coming from public places and such, because if you touch any droplets, you can transfer it to your eyes, nose, and mouth. Avoid close contact with people who are sick. If a person has some kind of a bug that they've been fighting for a while, they're not sure what it is, it's best to just avoid them. It's best to play it safe at this stage. Clean any surfaces you have with Clorox and with the disinfectants. Stay home if you're sick. If your child is sick, stay home. If somebody's sick in your child's daycare, also encourage them to stay home. The world is much more connected than we realize. When disease such as coronavirus or Ebola breaks, please listen to your expert. This is my advice because, like I said, coronavirus is not a new thing. We've encountered it before in the past, but this is a more of a different mutation, and we're not really sure what to do. So the best advice is to take the advice from the people who've been there before. Here are my credits: the CDC, WHO, NIH, World Meters, Wikipedia, Slice, Carnival, Unsplash, CNN, Mayo Clinic, Google Scholar, PubMed, Readers, Forbes, and Goldman Sachs. This is me. Thank you. If you have any questions, please follow me on social media at OZionMD, or you can send me an email at OZionMD, info@OZionMD.com. Thank you.